They are so small that you need a microscope to see them, but so powerful that experts predict they could kill 10 million people per year worldwide by the year 2050. They are superbugs, drug-resistant bacteria that have emerged since antibiotics revolutionized medicine in the early 20th century. Indeed, the rise of these superbugs and the use of antibiotics are closely intertwined. All organisms change over time. This is a basic principle of evolution. Smaller organisms, such as bacteria, are able to evolve more quickly, adapting as circumstances require. In the face of antibiotics, bacteria have adapted with deadly efficiency. When a patient takes antibiotics to fight off a bacterial infection, the goal is to kill the bacteria causing the infection. Often, however, although most of the bacteria are killed, a few of the strongest bacteria survive. Thus, only these drug-resistant bacteria are able to reproduce. This sets up a cycle in which increasingly powerful antibiotics are needed to counter bacterial infections, eventually resulting in the development of superbugs, bacteria able to resist even the most powerful drugs. Scientists believe that a large part of this cycle is preventable. Few would dispute that patients who are genuinely ill should take antibiotics, but one recent study suggested that almost 50% of all antibiotic use is inappropriate or unnecessary. Some patients are prescribed antibiotics for ailments that would eventually clear up on their own, or for viral infections, against which antibiotics have no effect. In addition, some patients do not finish their course of medication, allowing bacteria to bounce back, but stronger. All of these factors contribute to the rise and spread of superbugs. Although many doctors find it difficult to refuse when patients request medication, in this instance, what may be safe and effective for the individual can be harmful to society as a whole. Another major factor that promotes the spread of drug resistance is the use of antibiotics for livestock. In Europe, many countries have long since enacted laws to limit or ban antibiotic use in livestock. However, in the United States, 80% of antibiotic use is for animals. In part, the drugs are used to prevent the spread of infection among animals, especially those that live in crowded conditions. However, farmers also use antibiotics because these drugs help animals to gain weight quickly. Unfortunately, such non-therapeutic use of antibiotics is problematic because it kills off the beneficial bacteria that normally live in the animal's digestive tract, leaving drug-resistant strains of bacteria to thrive. The widespread use of antibiotics for the past 70 years in both the animal and human populations and the resulting increase in drug-resistant bacteria have fueled an ongoing search for more powerful drugs. In the early days of antibiotic research, scientists were successful in finding new classes of drugs capable of fighting the drug-resistant bacteria that continually appeared. Drug discovery tapered off to almost nothing in the 1990s and 2000s, creating a global panic regarding the future treatment of infection. Investment has led to recent discoveries of new classes of antibiotics in the soil and inside the human nose, which offer some hope. But it will take years for viable drugs to be developed. In the meantime, very few weapons are currently available against the deadliest bacteria. Late in 2015, researchers reported the emergence of a strain of bacteria able to resist even the most powerful medications, those only used as a last resort. What can be done to preserve antibiotics for future generations? Scientists maintain that as individuals, we can make a difference with simple steps, such as regular hand washing. It is also important that patients understand that antibiotics are not always the right course of treatment. They should not be taken for viral infections or even for mild bacterial infections. Finally, it is crucial to take antibiotics out of the food chain. Fortunately, consumers are pushing for this, so we are likely to see changes in this practice in the near future. The fast food giant McDonald's, which sells millions of kilograms of chicken every year, is phasing out its use of chicken treated with antibiotics. If both individuals and corporations around the world continue to take steps like these, perhaps superbugs can be stopped. The alternative presents a grim picture for future generations.